My name is Dr. Girdhar Gyani. I am Director General, Association of Healthcare Providers India, and I am based at New Delhi. You see, the subject of clinical outcome is very important. Firstly, I have to take you a little backward because healthcare has not been the priority for India so far. Why? The reason is that for government to invest in healthcare, they had more priority roti kapda makan than bijli sadak pani. Healthcare still has not come to that stage where they invest money. It is thanks to the private sector starting from 1980 onwards that we are now able to have 5% investment of GDP in the healthcare. 1% coming from government and 4% is coming from the private healthcare. Now if you see, if this is the kind of limited expenditure from the government, the health outcomes is the key which has been missed all the time. Harvard study done recently shows by Professor Jha that 5.2 million medical errors are happening in India annually. Similarly, if you have read the British Medical Journal recently, it has again quoted that India, like any other developing countries, are recording a lot of medical errors. The reason is we have not trained doctors and nurses to measure the clinical outcomes. I'll give you a few examples like surgical site infection, urinary tract infection, VAP. These are the indicators which we must audit for each specialty of the medicine, which we are not doing because our main focus is to treat patient. So that is where, if you see, I am actually that way sorry to say that we have really not been able to come out with a national index of the clinical errors or medical errors so that other hospitals can benchmark. But National Accreditation Board for Hospitals, which I founded in 2005, actually is collecting data from 350 hospitals for past 3 years. Once this data is compiled, we will be able to have a national index, and then rest of the hospitals in the country can be asked to benchmark, and then we will be able to say that where are we in terms of other developing or developed countries. You see, the issue here now is that one, rural sector is being dealt only by government because private sector is not in position to go to the rural side. While doctor shortage is the most critical, major issue if you are asking me is the shortage of doctors, not MBBS. I am talking of the specialist. We have 50,000 MBBS graduates passing every year, but we have only 18,000 postgraduate seats. So every year these MBBS graduates compete for those 18,000 seats, and remaining people keep on working as a junior resident because these junior residents cannot treat any specialty medicine. So even the community health center, which is run by government, has position of 4 specialists, MD or MS what we call. We are not able to find because when we have pupil shortage in cities, who will go to the rural side? So immediately government have to do is, which I think they are working on it, to increase the postgraduate seat so that you can create the physicians, surgeons and anesthetics, pediatric, gynecologists, all these areas we have acute shortage. That is why if you see the MMR and the children, if you see the ratio, infant mortality rate, what we call IMR, is today around 37 or 34, which even country like Bangladesh is ahead of us. So because we do not have the pediatric doctors to be in the areas, we are having this problem of poor IMR and MMR. And other indicator I can tell you is that HGI index, you must have heard, Human Development Index, we come somewhere around 188 world over. Why? Because this HDI is based on education, healthcare and the capacity to earn. We are poor on healthcare. Similarly, literacy also we have recently come up. So unless we put more money or changes in the policy to create more doctors. And third and final issue from my side is that the hospitals and medical colleges, 2/3 medical colleges are in the south and western side of the India, where 1/3 population reside, and 2/3 population like UP, Madhya Pradesh, Bihar, Odisha, West Bengal, Kashmir and above. we have got only 1/3 medical colleges. So this was, now the person who is studying in South, let us say in Bangalore, even if he is from Manipur, let us say, after studying 5 years, 2 years post graduation, do you think he will go to Manipur? No, he will settle down in Bangalore. So this is the big mistake we did. We allowed medical colleges in Andhra, Tamil Nadu. I'll give you an example. Like in Andhra or in Tamil Nadu, we have roughly 45 medical colleges in each state. While a state like Rajasthan, UP and Bihar, around 18, 20, 22, that's all. The population is 2 times, but the medical colleges are half. So that is the big issue that we have not been able to take care. Now the other challenge I will tell you is 2 issues we have to focus: patient safety and affordability. All of us are today talking about the affordability. Everybody is saying healthcare is very costly. Why you are feeling costly? Because none of us budget for the healthcare. You budget for your children for their education. Middle class family is putting 3,000 rupees per month for their children to study in public school. But he thinks he will never fall sick. So he doesn't cater for it. And when some disease comes, suddenly he has to go and he realizes he has to pay 40,000, 2 lakh, 3 lakh, 4 lakh, which for which he is not prepared. Now, patient safety and affordability are linked. If you say, I want only affordability, I'll provide you quacks, let us say. Are you ready to take treatment of quack? Quack is the cheapest medicine. But patient safety means good technology, good doctors, good medical protocols, what we call standard treatment guidelines. Now these are missing in our healthcare scenario. In Kerala we did this study, 70% doctors are routinely prescribing antibiotics, routinely, because they do not really are trained on the standard treatment guideline. Now, so I will say first we must focus on patient safety. We must measure hospital acquired infection rate. We must have surveillance on the infection and antibiotic policy. All doctors should be trained, nurses should be trained on infection control. So once you build that environment of safety, then you have to talk of affordability. So here I will only sum up in 2 minutes. I will tell 8 states: Andhra Pradesh, Telangana, Tamil Nadu, then Karnataka, Maharashtra, Gujarat and Rajasthan. These have their own governmental health insurance schemes. Like Arogyasri is the famous one in Andhra Pradesh. They provide 2 lakhs rupees per family for a year, which is really good amount, But remaining states do not have that scheme. So central government has only one scheme for them, that is below poverty line, RSBY, Rashtriya Suraksha Bima Yojana. But that limit is only 30,000 rupees for family of 5 for 1 year. What can you do in 30,000? So I think Mr. Arun Jaitley in this budget has announced 1 lakh rupees scheme and 1,30,000 for the senior citizen. I am told that the next 3 months this scheme will be finalized and will launch across the country. So we are now working closely with the government to tell them that if this scheme is launched across the country for below poverty line, then for above poverty line people, you should have a scheme where person pays 50% co-payment, 50% you subsidize. So if you do all that, you can have universal health coverage. Mr. Narendra Modi, when he took over, he announced that he is going to have National Health Assurance Mission, something like universal health coverage. But he is not able to launch because there is shortage of money. But if you do this kind of thing, what I am saying now, that 1 lakh rupees and co-payment by the above poverty line, we will be able to cover the entire population. And my belief is on the basis that Thailand-like country with a 5.5% investment of GDP, percent of GDP in healthcare, they are having universal health coverage for the whole nation. You are having 1% from government, 4% from the private, 5. So 0.5 or 1% more you can cover. So I am saying give priority to the patient safety and then talk of affordability, don't talk reverse. Affordability. That affordability first and patient safety later, then I think you will have serious problem, particularly when I mentioned to you that study of Harvard that 5.2 million medical errors are happening. So I think we have to take cognizance of that. This government health insurance scheme, which 8 states are running, if central government gives little more money to remaining states, so they can also come up with a schemes like that, 2 lakhs rupees per family per year, or this 1 lakh rupees across the country also will help to a great extent. But your question I think still will be not complete, because you will ask me that in big cities, yes, people will go take treatment, government will pay cashless scheme. But what about the smaller town? In smaller town we do not have hospitals. Private sector is not going there because it is not viable. So the government must give 5 years tax holiday, give them the land at the concessional rate. Then many of the entrepreneurs will go and set up the hospital in tier 2 and tier 3 cities. And finally, the primary health centers mostly are not running properly in states like Madhya Pradesh, Bihar, Odisha, West Bengal. Private sector is ready to take over the primary health center on PPP model, provided you give them the budget, whatever budget you are spending, same budget you give them, they will run it for you. The interest of private sector, although it will be loss for them, but the interest is that patient from primary health center will be referred back to some of them to their own hospital. I think win-win situation. So that is the second solution to overcome the shortage of healthcare service into the rural area. So I think finally, I think my final word is the healthcare still is not a election agenda in this country. You don't win or lose the election because of the healthcare, like in Obama or in UK you have. So, but I think gradually people are becoming conscious. So that is why I am told that in third year of NDA government, now gradually focus is coming and healthcare will be getting priority. So let us hope that these 2-3 measures which I told you, if you utilize it, will get safe and affordable healthcare for the entire country.